Good day, everyone, and welcome to our Kodiak Solution webinar on leveraging Payor Market Intelligence to take the right action in 2026. My name is Matthew Lyon. I'll be your producer on today's program, and I've got a few items for you before we begin the session. First, I would like to encourage you to get the most out of today's program by being sure to share questions and comments you have at any time during today's program. We'll be monitoring those. The team will try to respond to some of them behind the scenes, and any questions that go unanswered, we will always gather up, hand over to the team so they can follow up with you outside of today's session. One of the most frequent questions we do get from attendees is, how do I get a copy of the slides? So let's go ahead and address that one for you. You'll find a PDF copy of the materials for today's program waiting for you in the resources area. Information on our presenters, items about upcoming events, and details related to today's topic that we think you're going to find beneficial. So please take a moment and check those out during today's session. Also, a quick disclaimer, the information provided herein is educational in nature and based on authorities that are subject to change. You should contact your Kodiak advisor regarding the application of the information provided in your specific facts and circumstances. Now, with those items behind us, it is my pleasure to welcome all of you to our Kodiak Solutions webinar on leveraging Payor Market Intelligence to take the right action in 2026. Kicking off today's program is going to be Nick Armour, a director in Kodiak's data analytics area. Nick, over to you.
Thanks, Matthew. Hello, everyone. My name is Nick Armour. I am a leader on the revenue cycle intelligence team here at Kodiak Solutions. I oversee our SaaS and DaaS offerings, including Revenue Cycle Intelligence Suite and Payor Market Intelligence, which we're going to review and touch on today. With me today is Clay Schmerber, one of our Revenue Cycle Intelligence leader, market operations. And Clay is going to be running us through a quick demo of our Payor Market Intelligence solution after we touch on some of our key data elements. One major trend we've seen with all the great data we have available within the Kodiak platform, which we'll touch on upcoming slides, is that net revenue leakage has continued to grow steadily over the last few years and is approaching nearly 10%. And what we're seeing is it's not just denials that are driving this increase. Our objective of today's meeting, and really our Payor Market Intelligence solution, is to arm providers with more actionable data and insights for their discussions with payers and internal stakeholders, along with guiding providers and their limited resources to ensure you're focusing on the right problems. Quick overview of the agenda we'll be touching on today. We'll quickly highlight the Kodiak platform. We'll touch on the best data in the business of healthcare. We'll review a case study in where we've seen a customer have a lot of success leveraging our Payor Market Intelligence solution. And then, as I mentioned, Clay is going to be walking us through a quick demo of our Payor Market Intelligence solution as it is today. Most people by now are familiar with Kodiak's flagship product, Revenue Cycle Analytics, or RCA, which has been in the market for over 20 years and has successfully been helping providers predict net revenue and assist with the month-end close process for over 20 years. Over these 20 years, we have accumulated over 40% of all hospitals across the nation. Through our RCA solution, we receive daily data feeds from our customers with all account, transaction, and charge information. What our RCI team is specialized in is pulling together all of this great data on the Kodiak platform, de-identifying the data, and translating this hub of data into what we call our benchmarking database. We use our benchmarking database to provide additional solutions and services and provide context into market performance and measure how our customers perform to the market and identify areas of opportunities along with success stories. Whether we realize it or not, we all leverage data every single day to add context and help guide our decisions. Just yesterday, my wife and I had a doctor's appointment, and a few hours before we needed to leave, the first thing we did was pull up Apple Maps and Google Maps. Not because we didn't know where the office was, but because we wanted to understand how long it was actually going to take to get there. That estimate wasn't a guess. It was based on massive amounts of historical data, traffic patterns, time of the day, typical delays, all combined to give us a realistic expectation of when we needed to leave. Without that context, we could have left too early and wasted time, or left too late and arrived stressed or behind schedules. The map didn't drive the car for us, it simply provided a benchmark for what on time looks like in that moment. The context into how long something should be taking or how the market is performing is exactly what we're leveraging our benchmarking data to guide and provide direction for our partners. Across revenue cycle and operational performance, we often look at metrics in isolation. We know our numbers are trending up and down, but without the market context, it's really hard to know what these numbers mean. Are we performing well relative to similar organizations? Are we behind peers facing the same payer mix or volume pressures? And what is a realistic, achievable target for our teams? That's where benchmarking is essential for healthcare leaders. Our benchmarking data provides that context. By leveraging real historical performance from comparable organizations, it helps answer the question we ask every time we check our maps. Given what we're facing, where should we reasonably be? With that clarity, leaders can focus efforts on where they matter most, align teams around realistic goals, and make decisions grounded in market reality rather than assumptions. At Kodiak, we provide access to the most trusted, thorough, and diverse data in the healthcare business. From a trusted perspective, the most important thing to us is being safe with all the data we have. We de-identify in accordance with HIPAA and SOC compliance standards before any of this data is leveraged in market comparisons. It's also used by top state and federal hospital associations across the country, as well as leading health systems and RCM vendors nationwide. And we're consistently recognized and referenced by credible national media outlets for reliable market insights. From a thorough perspective, we have over 55 plus industry standard metrics that are normalized to be able to compare across the market and benchmark accordingly. We have integrated daily data feeds from EMR and patient accounting systems, capturing all accounts, charges, and transactions. And this data is reconciled monthly to all of our customers' general ledger to ensure exceptional accuracy and data integrity. From a diverse perspective, anytime you're comparing against a benchmark, it's very critical to ensure that you have a diverse sample that is a true apples to apples comparison with what you're looking to compare against. Our benchmarking database has over $2.1 trillion in annual gross revenue, over 2,300 hospitals nationwide. We have all of the major EMR systems that are out there in the market. And then we can also customize that peer group to our customers' needs, whether that's based on the organization type, or urban or rural facilities, academic or children's hospitals, certain payer mixes, certain geographic locations, state or region, and even by size, such as net revenue per day or bed size. Kodiak's benchmarking database really differentiates a lot of the comparable and other benchmark offerings in the market to date. We constantly hear from the hospital associations, from our customers, that there's very limited amounts of good access to the amount of credible, detailed, and up-to-date data, healthcare data in the market. And when we do have a source that has all that data, we're constantly seeing inconsistencies that are collected with unreliable data sources, such as it's survey-based, it's unvalidated, or it's missing key data elements that aren't telling the complete story, such as having the claim information from the EDI data that we're able to connect to that critical EMR data, with which we're able to do in our benchmarking database. We also see from other benchmarking offerings that there's a lot of variations from the KPI methodologies and the logic that is used to create these metrics. So when you're comparing across health systems and peer groups, it's not a true apples to apples comparison. For example, we have a metric called True AR, where we're able to look at if a customer is netting down at the time of billing or writing off at gross. We're able to normalize and adjust that to ensure we get that apples to apples comparison and account for various operational differences that we see across health systems. Existing solutions often inherit significant bias in benchmark offerings, whether that's one or limited EMR systems, small volumes, prohibiting critical focused, and really ensuring we have relevant cohorts that we're comparing against. And finally, as I mentioned, our flagship product, Revenue Cycle Analytics, is a major tool leveraged by finance departments. We have the capabilities to really bridge the gap between revenue cycle and net revenue performance. Kodiak's benchmarking data is constantly being recognized by national media and industry associations as a definitive source for credible healthcare performance insights, on top of leveraging it for all of Kodiak's solutions and offerings. Most recently, Kodiak's data was leveraged in a letter to Dr. Oz around the 2 midnight rule. Now I'll pass it to Clay to walk through a case study in a demo of our Payor Market Intelligence solution.
Thanks, Nick. I'm going to walk everyone through a use case study that we had with one of our customers that heavily utilizes Payor Market Intelligence to not only drive actionable impact within their own organization, but also with payers. So there are a lot of use cases that you can utilize the benchmarking data for. One of them is taking it to the payer so that you can help them understand that you're being treated unfairly comparable to your relative peers. So first, I'll help by giving context to this issue and situation that we saw with a customer and how we help them work through that issue to drive actionable change within their organization. This was a 5-hospital system in the state of California, specifically related to their Blue Shield inventory. So when we looked at PMI and their data, we saw an immediate outlier. The system's request for information denial rate was about more than 5 times higher than other Kodiak RCA users within the state. This was largely driven by a policy change that was enacted at the payer. What is really important here is that benchmark data is key. PMI really didn't just say denials were high, it actually quantified how far outside of peer performance this payer-plane relationship was. So when we started looking at these, we really armed the client with this view and some other statistics related to AR performance, and they were able to address the outlier status with the payer by leveraging this PMI data. The message to the market and to internal stakeholders is really clear. This wasn't any just noise. It was an actual measurable and payer-specific problem that they needed to address immediately. The goal was really simple, to try to bring back performance, not to significantly further better than the market, but just in line with their peers. What you'll see on the right here is the chart for Blue Shield RFI denials when we first identified this issue. So the purple line is going to be the hospital system. In January 2024, those RFI denials were around 51%, which was extraordinarily high compared to the market. Through the year, you'll see that those denials fall steadily. This was as a result of this customer taking the data to the payer and letting them know that compared to the rest of their peers, they were performing significantly worse within this one metric, even though they were functioning the same as those same peers. The green line is going to show the California benchmark, relatively low and stable, showing where the broader market sits. The key takeaway here is that using PMI to highlight and address the outlier resulted in dramatic reduction in RFI denials with Blue Shield as a result of those conversations. On the left, you'll see the actual impact of those conversations as it relates to their AR greater than 90 days. What you can see here, that by January 2025, once they started seeing those requests for information denials significantly decrease, they also saw that in their aging AR. It decreased by over 17.5% compared with 2024. So in other words, fewer claims are getting stuck and aging out past 90 days and getting more prompt resolution from the payer. This benchmark really matters because the bridge between these two charts is the benchmark insight. PMI quantified the gap 5 times higher than the peers, which then gave the system a credible basis to actually engage the payer and prioritize internal attention. Once that outlier was addressed, performance moved quickly. First in denials, then the result of that was the aging AR profile. For operations, this essentially helps with less churn on request for information follow-ups, easier and clearer path to resolution for claims. And from a finance perspective, it really means fewer avoidable delays and a healthier aging curve. Strategically, it helps confirm the value of targeted benchmarking. Find the payer plan outlier, use the data to frame the conversation and bring that to the payer, and then also track the impact over time. So now I want to touch on 3 key pillars that Kodiak focuses on from a revenue cycle management and finance standpoint, and that's really going to be yield maximization, balance sheet management, and revenue optimization. So as we look at balance sheet management and the top performers within the Kodiak platform and community as a whole, what we see is that oftentimes clean AR is controlled AR. Most of our best performers are resolving accounts fast, focusing on high value follow-ups, so those accounts that are really going to drive net revenue impact. And really, they also focus on credits performance and overall aging AR, so keeping everything over 90 as low as possible. Secondly, we look at yield maximization. Top performers typically aren't just chasing dollars, they're trying to capture them as best as possible. From point of service cash collections to denial analytics, they're trying to deploy precision tools like denials intelligence and payer market intelligence and strategies to try to eliminate leakage as much as possible. A lot of that leakage is primarily coming from your final denial write-offs, but not only that, also your bad debt write-offs. And lastly, I'll quickly touch on revenue optimization. Again, what we see in our top performers is a lot of times that revenue optimization is not accidental. It's very engineered and planned when they're looking at enhancing that, whether it be from charge capture, clinical documentation improvement, and the like. So dedicating specific teams to enhancing that within organizations, we find is really the most effective to enhance your revenue as much as possible. So now I'm going to quickly walk you through a quick overview of our Payor Market Intelligence application and what it actually looks like in the website. So within our application and PMI specifically, we're really focusing on all of our metrics, but the one key granularity here is going to be our payer level of detail. So we, as Kodiak as a whole, have gone through around 1.5 million I-plans over the past couple years and normalized them all down to 3 groups. That is one going to be the parent group, which is traditionally going to align with the financial class. Secondly is going to be the payer group. And when you think about that, think about your commercial Blue Shield or your commercial Blue Cross Blue Shield, your commercial Aetna, commercial United. And then thirdly to that, for example, if you have Aetna plans within your state and you're looking at Coventry plans, First Health, Meritain plans, we also benchmark down to that level, and that's going to be called our payer subgroup. Now, what that mapping and that's normalized across the entire market allows us to do is calculate opportunity numbers at a very granular level as it relates to administrative burden, net revenue leakage, or any of our other metrics that we have within the Kodiak universe. 2 main metrics that we really like to focus on are going to be net revenue leakage and administrative burden. Net revenue leakage is going to be a culmination of your final denial write-offs and your bad debt write-offs over top of your net revenue. Now, what this is really saying is the percentage of your overall net revenue as an organization that is being lost to just that, final denials and bad debt. Oftentimes, revenue cycle operators can easily focus on final denial write-offs because those are true usual actions of the payer or a breakdown in revenue cycle performance. One that's not talked about enough, though, is bad debt write-offs, and one that we've continued to see grow in the market in the Kodiak universe over really the last 4 to 5 years is patient responsibility. As it continues to grow, specific plan designs are pushing more and more the allowable to the patient. At the end of the day, it doesn't matter whether it's the patient or the insurance company, that the provider's stuck holding the bag when it comes to those dollars having to be collected. And oftentimes patients are not able to make that full payment. So it ends up resulting in bad debt. So one thing we pushed within our community very often is bring bad debt into conversations when you're talking to payers from an overall yield maximization standpoint. Now, how this application functions, I mentioned quantifying opportunity down to that payer subplan level. You'll see that in this demo environment, this customer would have a 4.03% leakage percentage. The market's sitting at right around 8.82%. So from a 30,000 foot view, you look great. You're more than twice as better than the market. However, that number on the right, you'll see is around $10.2 million of opportunity. How that opportunity is quantified is we look at this metric down to every single subplan within your universe and then quantify if you are able to get to at least median performance in all of those different subgroups, how much additional net revenue could you potentially collect? And that's where that $10.2 million number comes from. So it's not just looking at the organization as a whole, but identifying opportunity down to the payer and even the I-plan level to how you can better perform, not only from a national perspective, but from very granular peer group perspectives. So for example, if you want to look at urban and rural hospitals within a certain state, academic, non-academic, and so on and so forth, just about anything that's able to be identified from a national perspective, we can benchmark against it. Administrative burden is the second main metric that we look at in our top section of our dashboard, and that's going to be the costs associated to denials, which is patient responsibility over top of net revenue. In a nutshell, this is really assigning a dollar value to every initial denial that you receive within your organization, adding that together with your cost to collect from a patient responsibility standpoint, and then putting it over your net revenue. What this metric is essentially saying is that this organization is spending about 0.5% of their overall net revenue on resolving a lot of claims. And what we call that is, again, payer administrative burden. So a lot of this comes from things like requests for information denials that we've seen increase over and over and over in the market, and that we saw increase once again in 2025 as it relates to prior years. We continue to see that being a headwind as we go into 2026. Hopefully, we will see a little bit of relief as payers are able to pull medical records directly off of platforms in the future. But as of now, this continues to be a large issue for a lot of organizations. The market and opportunity numbers within this metric and what you see in the top right for that 597,000 function the exact same way as the net revenue leakage section. So now I'm going to walk a little bit more through how we identify what that leakage is. And one major area of concern that we see as we go into 2026, and that, as managed Medicare continues to be a problem for a lot of organizations, we expect that to continue to grow as we go into 2026 and the years beyond, with the overall further adoption across the market within managed Medicare plans. Traditional Medicare, oftentimes, if you do it right, you're going to get paid. With managed Medicare, you can do everything right, and oftentimes you're going to end up with a denial of some sort. Now, when we try to identify opportunity and go down to the second section of our dashboards, we're again running these calculations at very granular levels. So if we wanted to focus on, let's say, that managed Medicare section that we had talked about previously, you could drill through on this dashboard and identify specifically what payers from a managed Medicare standpoint are driving your administrative burden and also your net revenue leakage. As you can see here within this customer's environment, United is a very poor performer when it comes to net revenue leakage and administrative burden. So what this can help you do is identify what you need to focus on from a market perspective, as well, what is the biggest impact to your overall net revenue, right? If one of these payers is a very low proportion of your overall net revenue, it oftentimes doesn't make a bunch of sense to go and try to get them much farther or even in line with the market, because it's not going to move the needle from a financial operations perspective. As we go back out into the dashboard and start looking a little bit at what I call the bread and butter of our application, that is going to be this bottom section here. So what we have here is all of our 52 metrics in one consolidated format. So there's a little bit of color coding within the application. Essentially, if you see something red, it means you're the bottom third of the percentile basis of our Kodiak platform. If you're green, you're in the top third of our Kodiak platform for that metric for the specific period selected. Now, again, RCA or PMI is built off of the RCA platform, and that is really a unique differentiator within our data set, is being able to have accurate net revenue that ties to your GL on a monthly basis. You could be much better than the market or even much worse than the market. For example, in commercial managed care Kaiser, for this specific customer, they have a 26% net revenue leakage number. It's very poor compared to the market. It actually puts them, in a very, very low percentile. However, when you look at the actual net revenue associated, even if you got it to market performance, it's not, again, going to move the needle from a financial perspective. Much more of your time is better used in other areas, such as potentially increasing your patient collections on your Blue Cross Blue Shield inventory, and even potentially reducing final denials or having a conversation with the payer about how much of the allowable, as you can see within patient responsibility, as a percentage of gross charges, is being pushed to the patient. Another key aspect of the benchmarking database, and really what it is derived from, is utilizing the benchmarking data as much as possible to help set performance targets within your organization. So oftentimes you'll have leaders, and even leaders will set goals and say, if our AR over 90 is, 35%, we would love for it to be 30% within a certain payer or financial class or whatever it may be. What our benchmarking data can help you do within your organization is set realistic performance targets within those specific areas so that you're not chasing an unattainable goal. How we do that is we look at a lot of these metrics from a percentile standpoint. So for example, when we look at our AR over 90 metric, as we see here, the market rate within this client's peer group is around 33.15%. The 75th percentile is around 27.95%. This client currently sits between the 50th and the 70th. So the 75th is absolutely an attainable goal. However, if you look at your AR over 90 and say, hey, we want to get to 20%, oftentimes that's not really attainable. That would put you probably at the absolute best performer in the state, and is great to have as a stretch goal, but you also want to make realistic goals for your team that they can achieve within a fiscal year or whatever that time frame may be. Now, as we talk about these percentile metrics, performance, goal setting, and things of that nature, we have some exciting things coming down the pipeline. And I'd like to pass it back to my colleague, Nick, to talk a little bit more about the future of where benchmarking and the revenue cycle intelligence suite as a whole is going.
Thank you, Clay, for walking us through the Payor Market Intelligence solution and how customers are using it today to help address many of their payer issues and leverage our benchmarking data to give them visibility into insights and trends they haven't had insight into to date. Well, we're hearing a lot of success stories from our customers and how they're leveraging Payor Market Intelligence today. We're very excited to announce that we will be going live with our physicians benchmarking, an enhanced version of our HB hospital benchmarking fall of 2026, where you'll be able to benchmark not only at the facility and health system level, but you'll be able to get much more granular and look at things such as service line, patient type, and service types to find even more areas of opportunity and success. Now I'll pass it back to Matthew for some closing remarks.
Nick and Clay, thank you so much, gentlemen, for taking us on the journey today and for the demo as well. We saw a lot of great questions come through. Do want to remind our audience members, I know the team's been responding to some of those via chat, but if we didn't get to your question, they will be gathered up, handed over to the team so they can follow up with you outside of today's broadcast. Also, want to remind you, you have a few seconds to still download a copy of the slides. If you've not picked those up, they are waiting for you in the resources area. Of course, you can add Nick and Clay to your LinkedIn connections if you don't already have them as part of your Rolodex there. And for those of you that would like, we've got details about upcoming events as well. At this time, do want to let everybody know we have a post-event evaluation. It's going to open up in a new window. Perfect opportunity for you to let the team know what you thought about today's session. We're looking forward to your feedback there. And I want to take a moment and thank all of you for investing the most precious of commodities, and that is your time. We hope that you feel it was well spent with us. We look forward to you joining us on an upcoming broadcast. Have a great day.